The next person is Dr. James M. Campbell, City of Scottsdale Human Relations Commission. He is a board member. Let me give you a little bio on him. Dr. Campbell is a Distinguished Life Fellow of the American Psychiatric Association. He's board certified in psychiatry at the American Psychiatry and Neurology Board in Administrative Psychiatry by the American Psychiatric Association. His expertise are in the fields of health, care development and management, military psychiatry, forensic psychiatry, suicide prevention, substance abuse, alcohol addiction, psycho-oncology, and the treatment of sexual disorders. Dr. Campbell is a retired Chief of Staff of the Veterans Administration Health System, and also a retired Colonel, Flight Surgeon, and command medical units in the United States Air Force Reserves. He is a graduate of the North Atlantic Treaty Organization, Senior Policy School. He is a recipient of various military awards and commendations. He was the Chief Medical Officer and Consulting Psychiatrist of the Maricopa Integrated Health System, the largest county hospital of Arizona State. Dr. Campbell held various local, state, and national medical leadership positions. He was a member of the Membership Committee, Human Rights Committee, and an oral board examiner of the American Psychiatric Association. He was appointed by the governor of the state of Arizona as a member of the Arizona Board of Medical Examiners. Among his papers and presentations are Psychology of Terrorism, Management of Acute Combat Stress, Hostage Negotiation, Psychological Aspects of Hostage Taking, Psychiatric Emergency in the Military, Suicide Prevention, Death and Dying, Sexuality and Aging, Sexual Dysfunction Diagnosis, and Advances in Sex Therapy. His present community services include serving as a member of the Board of Directors of the Wellness Community, a national organization that provides free psychological support to cancer survivors, their families, and significant others. He's a member and past commissioner of the Human Relations Committee of the City of Scottsdale, Arizona, a commission that advocates and promotes all dimensions of diversity. He's chairman of the Professional Advisory Board of the Asian Pacific Community Action of Arizona, APCA, I believe it's pronounced, a non-profit organization promoting the education and prevention of diseases among Asians and Pacific Islanders. He is a member of the Investigational Review Board of Banner MD Anderson Cancer Treatment Center in the city of Gilbert, a medical center dedicated to research and treatment of cancer. He is active in promoting the welfare of a large population of refugees in Arizona. Dr. Campbell and his wife live in Scottsdale, Arizona, has 2 grown children and 8 grandchildren. Currently is in an active psychiatry consulting practice and a clinical surveyor for accreditation of health care organizations as required by the Center of Medicare and Medicaid. With a warm welcome, please welcome Dr. James Campbell.
At the end of this program, I will give you, with that elaborate introduction, I think you cannot help me. Come to my office for consultation. All right? At any rate, thank you very much for inviting us here today, John. We met in one of our presentations and he invited us. And I want to tell you that it really touches me and my wife to see your presentation today. Spirituality, as you know, is an important ingredient in healing. Ways before, when I was early on in medicine, we don't include spirituality in hospitals. You know, very seldom do you see something about spirituality, but right now, in the last 2 years, when you go to any hospitals, spirituality is an important ingredient and accepted modality of treatment in the care of patients by medicine. So this demonstration, and many among the nations, is healing all of us. And we hope that with you and the Scottsdale Human Relations Commission as your partner, we will one day come to solve the problem of racial inequality and get to racial equality. Now, I will make this short, but take a look at this. Campbell, I'm practicing psychiatry. People look at the yellow page and says, there is Campbell. I want to go see him because he must be wearing kilt and blue eye. Then, when I come out of my office and open the door and introduce myself, do you see this guy? And you can see some of the looks in their faces. They would think I am an impersonator. And some of you would be wondering, what the hell is his name, Campbell? Well, quickly, even if you don't want to know it, my grandfather was from Ohio. He went to the Philippines as part of his engineer and liberated us in 1898 from the Spanish occupation. Thus, I circled around, and I am a Campbell with an Oriental look. All right? So there is unity there. Don't you see? The diversity of... Okay, since I got that clap, I will stop shortly. I want to tell you as a psychiatrist, you have heard about that for a long time from Ted. To me, there are many forms of racial discrimination. And most of us are aware of overt, very visible discrimination among races. And we have improved on our awareness of overt discrimination. We have improved in how we deal with them. But I want to tell you that we are a long, long way from solving subtle discrimination. Discrimination that is sometimes sophisticated, sometimes you are not aware, but just as equally devastating than overt discrimination. That all of us have to be aware. I think all of us here in Scottsdale, we live with the idea that, hey, that's not happening around here. We will know when discrimination is, and we'll take care of that. But I want to tell you, believe me, I walked through that process of subtle discrimination that you don't know what's hitting you or why it is happening to you. Quickly, I arrived in the United States, having taught medicine in the Philippines, but I have to go again for internship and residency. And early on in my life, I keep wondering why there are positions that I could not get, or some of the people from different countries could not get while they were here. And eventually I learned, and eventually I asked from some of my mentors, what's happening? And some of them were good enough to say, hey, because you are a Filipino, or because you are not of the white race, in essence. What do? I just work hard and take 2 steps higher than any of the others that I have to compete. That's how most of us can achieve. But the reality is, if I don't know that there is discrimination, and there are a lot of people who does not know that subtle discrimination is present, that you will not go anywhere, you will not be able to get where you are going to without you realizing. So, again, subtle, non-overt discrimination is just as harmful as overt discrimination. Think about that, folks. Thank you very much.